Recently, you had said that there's no medical expert panels who are in favour of state border closures. What's your position on the new border closure between New South Wales and Victoria?
Given the increase in numbers, given the sustained community transmission, given the breadth of it, our advice from our Acting Chief Medical Officer and the state advice said that the threshold had been reached, and so we do accept that this is a difficult but necessary measure at this time, given those facts.
So what is that threshold, and how might that apply to other states going forward, and the potential for more borders to be closed?
Well, what we've seen here is a sustained significant outbreak. So a sustained significant outbreak with the risk of transmission across borders. That's what's occurred over the last week and a half in Victoria as the numbers have grown and they have continued to grow. And so our focus right now is to contain. And we've always had, since February, we set out the concept of rings of containment, local lockdowns, broader areas, and those rings of containment have now been extended to the borders because we have 7 states and territories where we have completely flattened the curve. Effective, zero community transmission. There's always the potential for new cases. We need to be clear about that. But we have one state, and in particular, one city, and within that, one area, the north and the west, where there's a very serious and significant outbreak. That's why these measures were agreed upon yesterday between the Prime Minister and the Premiers of New South Wales and Victoria, following the advice we had from Professor Paul Kelly.
Why do you think community transmission has happened now and not before?
So what we've seen is a few things happen. Firstly, there was an underlying community transmission in Victoria which had sustained itself for longer. But then you had the hotel quarantine breaches, which have clearly been significant and have had a very significant effect, as well as once there were the protests, there's no doubt we saw a relaxation from some of the social distancing standards. So those things came together against the base that whilst Victoria was doing very well, there was still some underlying community transmission, but with an originating source coming out of the hotel quarantine breaches, plus a change in behaviour following the changed messaging, effectively, the double standards that many people saw from 10,000 people getting together. So that's the situation. In terms of the actions, right now, we stand ready to assist. The military's on standby to assist with hotel quarantine if necessary. The testing in Victoria is at very high levels, over 20,000 a day and over 25,000 yesterday. The contact tracing needs to see every case every day followed up. And again, the military is ready to assist with that. Every case, every day must be the standard that we achieve. And then finally, there are the difficult but necessary distancing measures. And I want to thank everybody who's been affected. I've heard interviews today from people within the towers. Extraordinary spirit, challenging, especially for young families. And we'll get through this, but they are doing it on behalf of all Australians.
Minister, the point has been raised, and indeed it was mentioned by Matt Canavan on the show a little bit earlier, that why should regions pay the price for what goes on in these metropolitan areas where there are no cases of COVID-19? Is that a reasonable point to make?
Well, wherever possible, what we've tried to do is work as a country to make sure that the restrictions are as limited as possible and as targeted as possible. And so those within the towers have the most onerous restrictions. Those within the 13 postcodes and the 39 suburbs have the next layer of restrictions. And then more generally, the border closures are between Victoria and New South Wales are challenging and are difficult. I spoke with the New South Wales Health Minister last night. They are putting in place movement opportunities and movement passes for people who are in those border communities, and that's a recognition of exactly that point. But nobody is at fault here, but all of us have responsibilities to try to protect each other, looking around the world at the more than 150,000 cases a day. It's dangerous, it's deadly, and it's a highly infectious disease. So that's why we're taking these measures, offering the ADF a support, 350 coming to the border with up to 500 if necessary, and they're there to assist with the contact tracing or the hotel quarantine if that's required in Victoria.
Should infected people in those towers be removed from those towers?
That's a medical decision, and I'll leave that to the Victorian authorities. They are managing that on the ground, and they'll take the decisions that are ultimately about protecting the individuals, first and foremost, and protecting all of those within those towers.
If this trajectory continues, will schools have to close again?
I won't foreshadow what Victoria might do on that. If there were a stage 3 lockdown, then they'll have to, on a more general basis, which is the standard that we all lived through as a country in March and April, then they'd have to consider and make their own judgments on what's required there.
Okay, just on this outbreak in Albury, have you got what sort of concerns do you have about that?
Well, we know that the medical authorities are right onto it. This is one of the reasons why this unprecedented step, this large ring of containment has been put in place. What we don't want to see, now that the numbers have reached this sustained and significant level within the Melbourne area, is these cases reaching across the border into other states. And so that's exactly why the difficult but necessary steps have been taken. I understand that in those cases, the medical authorities are in control. They do have a very clear understanding of the cases, and they're taking steps to both isolate and to protect and support the individuals.
Are we at a point soon where you think masks may have to become mandatory?
Well, we've already provided 50 million masks, and I think it's very important to indicate that, and we've brought over 250 million into the country. Masks have always been an option that local authorities, state and territory authorities, could either recommend or require if there is a particular outbreak in a particular area. That's based on the level of community transmission. So the way that the medical expert panel has set up the instructions or set up the standards is they remain an option where there is intense community transmission. That's now with Victoria if they believe that the facts are there on the ground, and we have the supplies to support them. And one of the things has been there was a global mask shortage, a dramatic mask shortage in March and April, and we were able to maintain the supply lines to Australia, and we've already distributed 50 million, as I mentioned, but we have brought 250 million into the country, so we're well stocked if that's what's needed.
And just finally, are you satisfied that the people who are needing medical supplies in those towers are getting it?
Well, we know that this has been a very difficult situation for them. We'll continue to provide any information we receive to the Victorian government. I've heard 2 interviews this morning from Mohammed and Ahmed in their respective towers where, having had shortages, they have now been supported, and they felt that they are in a better situation. But it can be claustrophobic, it can be difficult, so we'll continue to provide any information we receive to the Victorians about particular families, particular groups that might be suffering shortages.
Okay, yeah.
We thank them, and we know it's difficult, but we will get through this.